There are several things that can make yeast infection to keep reoccurring back among women, and in this video we're going to be exposing all of them. So in case you have been having yeast infection that keeps going and coming back, the reoccurring one, and you've been wondering how you could stop it, this video is for you, and you need to make sure you watch this video to the end. Also share this video to as many people as you can so they can get this understanding you're going to be getting by the end of this video. Now before we proceed, we're going to be explaining what is yeast infection, the signs and symptoms of yeast infection, what causes yeast infection, and of course the treatment option for vaginal yeast infection. Now vaginal yeast infection is an infection also called vaginal candidiasis. Now there are different things that can cause vaginal yeast infection, but the major one that we do discuss is the Candida albicans. Now Candida albicans is a major topic of discussion because this is one of the major species of fungi that is found almost everywhere in the body. It is found on your hand, your skin, your anal opening, your gut, and so many other places like that. Even your vagina, it is located there, and it is found in minimal numbers. But the problem is when the environmental health of your body changes, then there will be an overgrowth of these Candida albicans cells, and that's where the problem starts from. And you keep having the signs and symptoms of vaginal yeast infection, like kind of discharge due to the irritation caused by the fungi cells in your vagina. It will be releasing some kind of chemicals that will make you to have a kind of white thick discharge that does not smell, but it makes your vulva to keep itching you every time. In women, you might experience some kind of pains while meeting your partner. You might experience pain while urinating. You might experience rashes around your vulva, around your vagina area. This is caused by vaginal yeast infection. Now, there are different things that can make you to have recurring vaginal yeast infection. And this is one of the major questions that people keep asking. They want to know what makes them to keep having this recurring vaginal yeast infection. Now, what can make you to be having recurring vaginal yeast infection is number one, when you are always using tight underwears. Women that use tight underwears will always have recurring vaginal yeast infection because vaginal yeast infection thrive more in moist environment. So when you are using tight underwears, it tends to make your vaginal lining or your vulval lining to be moist, and this can attract vaginal yeast infection very easy. It can attract Candida albicans cells very easy. Now the second thing that people neglect is abuse of antibacterial medication. If you're always taking antibacterial medications, anyhow, you are taking Flagyl, you are taking metronidazole, you are taking amoxicillin, ampiclox, anyhow without control, this can kill the normal floras in your vagina. Now that is what we call lactose bacilli. Lactose bacilli is a normal bacteria that is found in the vagina. This bacteria help in keeping the environment of the vagina very healthy. Now what happens when you are taking antibacterial medications is these antibacterial medication tend to kill these normal flora which are called lactobacilli, and it can make your vagina prone to so many infections, and yeast infection is one of them that can happen when you have abused antibacterial medication. Now the third thing that can make you to have recurring vaginal yeast infection is if you're always using dirty water to wash your pant, to wash your underwears, to wash your genital areas. This can make you to have recurring vaginal yeast infection. If you're that kind of person that is always using you're using perfume, you're using soap, you're using other scented agents in your vagina, this can change the pH of your vagina and you end up having a vaginal yeast infection. There are people that also have multiple sex partners. Now, in as much as vaginal yeast infection is not a sexually transmitted disease due to the causative agent or how it can happen to persons, you can also transmit this infection to other persons via sexual contact. You can transmit it to a man, and that man can also transmit it back to you if he's having it. And that's why you will need to make sure you're having just a sexual partner, because when you're having multiple sex partners without controlling yourself or without protecting yourself, you might end up having a vaginal yeast infection. Now there are ways you can help yourself in managing this vaginal yeast infection, and one of the major ways I'll be explaining to you is the home remedy before we talk about the medications you can use in managing vaginal yeast infection. Now one of the major home remedy that will help you in managing vaginal yeast infection is garlic. Adding garlic to your diet can help you in managing vaginal yeast infection. It's very effective in aspect of reducing Candida albicans cells. The second is yogurt. Now, in as much as yogurt is very simple, people know yogurt, but they don't know that yogurt can actually help in managing vaginal yeast infection. Now, I'll tell you how this happens. Now, yogurt contains what we call the lactose bacilli bacteria. This bacteria is a healthy bacteria that is located in the vagina, and this bacteria helps in maintaining the health of the vagina. When the acidic level of the vagina is going to a different level, the lactose bacilli bacteria will help in managing this pH of the vagina. It will help in managing the environmental state of this vagina. So once you are taking medications like antibacterial medications, it can end up killing all those bacteria in your vagina, and you have a high risk of having vaginal yeast infection. So for you to manage this, you need to take yogurt to help in supplementing the reduction of those normal bacteria in your vagina. So one of the ways you can use yogurt to manage vaginal yeast infection is by drinking it. When you drink it, it can promote the growth and the multiplication of these lactobacilli bacteria in your vagina. The second is applying yogurt to your vulva. Not applying it in your vagina, but applying it on your vulva. By doing this, you tend to increase the numbers of these lactobacilli bacteria in your vagina, and you have yeast infection known to be found in your vagina. Now, one thing you must note about this yogurt you're using is this yogurt must not contain sugar. Because if it contains sugar, then the lactobacilli bacteria and the candida albicans cells will feed from this sugar, and there will be an overgrowth of these cells. And mind you, when there's an overgrowth, there's a problem. And when there's a reduction in the number of these cells, then there's another problem. So make sure the yogurt you're using must not contain sugar. The second is that yogurt must be sterile. If at all you're applying it on your vulva, it must be sterile. Make sure it is not containing bacteria, it's not containing virus, it's not containing parasitic agents like that in that yogurt, because some yogurt are not being prepared under hygienic condition. But once you are to drink this yogurt, you can just drink it. It's healthy. Even if you are drinking yogurt that contains sugar, as long as you don't have sugar resistance or you don't have other problems with your sugar level, you can take yogurt that contains sugar and there will be no problem with that at all. But once you are applying it on your vulva, you must make sure it's sterile and it doesn't contain sugar. The third thing you can use to manage vaginal yeast infection is apple cider vinegar. Now, by doing this, you need to get apple cider vinegar, drop like 10 ml of apple cider vinegar in a warm water, then soak your vulva in that warm water for at least 20 minutes. Now, what will happen after doing this is that apple cider vinegar will eliminate all the candida cells in your vagina and your vulva. And it can also kill other bacterial cells that you don't even know about in your vagina. So apple cider vinegar is very effective in managing vaginal yeast infection and other bacterial infection, and you need to try this. Now, the fourth home remedy you can use in managing vaginal yeast infection is boric acid. Now, most of you might have been hearing boric acid, but you don't even know how to use boric acid, or you don't even know what is boric acid. Now, boric acid is an antiseptic and it is very effective in managing vaginal yeast infection, but it must be used with caution. And one thing you must take note of is boric acid is not to be swallowed through the mouth. Boric acid is being inserted inside the vagina. So when you end up taking boric acid by mouth, it can be hazardous and can be life-threatening. So never take boric acid by mouth. Rather, insert in your vagina, and this must be controlled or it must be recommended by your doctor, because boric acid can be corrosive. It can cause irritations to your vagina. It can cause so many problems to your vagina. So make sure before you take boric acid, discuss with your doctor so they can check the safety of this boric acid in your vagina. The fifth thing you can use as a home remedy for managing vaginal yeast infection is coconut oil. Now, coconut oil have been proven to be effective in managing vaginal yeast infection. So by doing this, you might need to apply coconut oil on your vulva to help in eliminating vaginal yeast infection cells around your vagina or around your vulva. And this is how you can manage vaginal yeast infection at home. Now, there are so many medications that I will recommend or I will prescribe to you in case you are meeting me with a vaginal yeast infection. And one of them is fluconazole. Now, so many people might have been using fluconazole and this infection keep recurring back. And I'll tell you why this infection might be recurring back. The first is you might have hormonal imbalance. When you are having an unbalanced or an imbalanced level of estrogen level in your body, then you might have a recurring vaginal yeast infection, because estrogen in your body can cause fluid retention in your body. It can cause fluid retention in your vagina. It can cause inflammation in your vagina. And once this level is high and you have not controlled it yet, and maybe you might not be aware that you're having estrogen level that is high in your body, then you keep having vaginal yeast infection that is recurring. Because mind you, I said any place that is moist, yeast infection thrive more in moist environment. So when you are having an uncontrolled level of estrogen, then there will be an uncontrolled level of fluid in your vagina. So you might be having recurring vaginal yeast infection, not because maybe you're using dirty toilet, you're using dirty water, or you're abusing antibacterial medication. The second thing that might make you to have recurring vaginal yeast infection is if you are abusing antibacterial medication. You know, I said this earlier, but I'm still going to explain that. Now, antibacterial medication can kill the normal flora in the vagina. So once they kill this normal flora in the vagina, then the pH of the vagina will be unstable, and this can give room for recurring vaginal yeast infection. So even if you're using fluconazole, you might be wasting your time, and this infection will keep recurring back. If you're having diabetes, an uncontrolled level of sugar in your blood, then this yeast infection will keep recurring back, because the candida albicans cells will be feeding from this sugar, and there will be an overgrowth of these candida albicans cells. So you need to control your sugar if you're having diabetes to prevent recurring vaginal yeast infection. Now, the second medication I will always recommend is terbinafine. Now, terbinafine is very effective in managing vaginal yeast infection, but this medication cannot just be taken without doctor's prescription. So you need to discuss with your doctor, let them check you to know if this medication is fit for your system, if your system can take up this medication. Now, there are other medications like miconazole. These are insertions you can insert into your vagina to help in managing vaginal yeast infection. There are other medications like taconazole. They are all creams, insertions like that. You can use them to also manage vaginal yeast infection. You can also use tabanafine cream to apply on your vulva to help in managing, irritations caused by vaginal yeast infection on your vulva or on your vaginal lining. These are very effective in managing vaginal yeast infection. Ketoconazole is also an antifungal medication that is very effective in eliminating vaginal yeast infection cells. So all these medications are some of the medications I will always recommend in case you are meeting me with a vaginal yeast infection. But mind you, these medications are not meant to be taken just by yourself. I'm not your doctor. You need to discuss with your doctor so he can check you to know the certain medication that will be fit for you. And don't take all these medications just at once like that. They might cause so many harms to your body. They might affect your liver and so many other organs in your body. So you need to discuss with your doctor so they can check you to know if these medications are fit for your system. So after watching this video, if you enjoy it, please do well to subscribe to my YouTube channel so you can get more amazing videos like this. And if you have questions you want to ask about this particular topic or about other things about your health, please do well to drop it on the comment section. And if you also have an experience you want to share with us, please do well to drop it on the comment section. Thank you for watching this video. I'll see you next time.